I'm Dr. Raghunath Babu, diabetologist, practicing in Diabetes Center, Hyderabad. So today we are going to discuss on hypertension. The hypertension is just like when the heart beats, when the heart beats, it pumps the blood into the vessels. Those vessels, when the blood is pumped into the vessels, the pressure created by it is blood pressure. Generally, the blood pressure should be in 120 by 80 or 120 by 70 is normal ranges, as our guidelines tells us. Once the blood pressure passes 140 by 89, we call it as hypertension, and we start them on medication. Generally, the causes of hypertension is high salt intake, excessive smoking, excessive consumption of alcohol, stress, and due to the age also. So, as the age increases, also sometimes the blood pressures tend to increase in the evening times. So, frequent monitoring and will help out to identify his values perfectly. And when the blood pressure crosses 140 by 89, we start them on medications. Generally, to prevent all these hypertensive systems, uh, generally we call the upper one is 120 as systolic, and down one as diastolic. Systolic is 120 by and diastolic is by 80. And once the systolic and diastolic monitoring should be done along with the pulse rate also. To prevent the basic hypertension, one should avoid smoking, overconsumption of alcohol, packed foods or stored foods, where the salt intake will be more in the packed foods. And stress levels also should be managed very well. For stress level management, doing yoga, exercise, physical activity will help in management of stress, and even the exercise will help in reducing of obesity, where you can prevent hypertension. And excessive smoking, which is also increases your blood pressures, where you have to stop, or else you have to quit smoking. Excessive consumption of alcohol is also a positive signs for this thing. And if the family history, one or two persons in the family has a hypertension, you should frequently monitor the BPs, and once the diastole and systole changes from one is higher than 140 by 90, meet your doctor, start on your medication, and along with your medication, you have to do all this regular physical activity, stress management, and smoking and alcohol should be avoided. Thank you very much.